Welcome to this presentation on the Handheld Doppler, which is part of a series of videos on free flaps for OR staff. In this presentation, we'll review setup and use of a handheld Doppler in the OR. In free flap surgery, in order to keep flap tissue alive, we reconnect it to new blood vessels at the recipient site with an operating microscope. A handheld Doppler allows us to find small blood vessels and evaluate the blood flow to the flap so we can monitor for problems with flap perfusion. With the handheld Doppler, we are checking the small perforator blood vessels that give blood supply to the flap. These are much more superficial than the main blood vessel pedicle we connect with the surgical microscope. So how exactly do Dopplers work? Handheld Dopplers work by emitting sound waves via a probe that travel through tissue, are reflected off moving red blood cells in the target blood vessel, then are detected by the Doppler, giving us audible information about blood flow. There are a variety of different Dopplers available in the hospital with different frequencies that are used for different purposes. It's important to make sure you have the correct Doppler. The higher the Doppler frequency number, the more shallow the depth of penetration. The lower the Doppler frequency number, the deeper the depth of penetration. Using the wrong Doppler could cause inaccurate information, a false sense of security, and frustration. For microsurgery and free flap monitoring, we want to use an 8 MHz Doppler, whereas a 2 MHz OB Doppler will penetrate too deeply, missing the perforator vessels we're trying to monitor. The 8 MHz Doppler used for flaps and microsurgery may be found in both wide beam and narrow beam models. Wide beam Doppler probes make it easier and faster to find the Doppler signals. Wide beam Doppler probes have a broad head with a rectangular tip, whereas narrow beam Dopplers have a narrower, circular tip. Now to discuss preparing the handheld Doppler for surgery. Let's start by discussing the components of a handheld Doppler device. Regardless of the model, there is typically a loudspeaker through which the sound is emitted, Doppler probe, which is used to locate the vessel, a coiled Doppler cord, which connects the Doppler probe to the Doppler box, and when not in use, the Doppler probe is held in place with the probe holder. When turning the Doppler on some models, there is a power volume wheel on the upper left side of the Doppler that is rotated upward to turn the power on as well as increase the volume. Make sure the volume on the Doppler is turned all the way up. On some models, there is a volume wheel on the upper left side of the Doppler that is rotated upward to increase the volume, and a gray power button to turn the Doppler on. Again, make sure the volume on the Doppler is turned all the way up so you can hear the signal. If the Doppler unit does not turn on, be sure to check the batteries. The battery door is located on the back of the handheld Doppler unit. You should go through a checklist checking the power and batteries before the next step of placing the Doppler in a sterile bag. In order to use the Doppler on the operative field, the Doppler device is placed in a sterile probe cover bag. This probe cover bag usually comes with ultrasound transmission gel. First, you want to be sure to place the sterile ultrasound transmission gel in the sterile Doppler bag so it can be in contact with the Doppler probe tip. Next, the Doppler is placed in the sterile probe cover, Doppler probe first, followed by the Doppler box. The excess length of the probe cover bag can be trimmed and a knot is tied in the probe cover bag to maintain sterility. A sterile rubber band is used to keep the probe tip in place and isolate the ultrasound transmission gel to the tip of the Doppler probe. Be sure to have sterile ultrasound transmission gel ready on a sterile towel on the back table to be used on the patient with the handheld Doppler. It's important to use ultrasound transmission gel to ensure you get a good signal when performing Doppler checks and looking for free flap vessels. The location of the perforator on the flap where the best Doppler signal or pulse can be found is marked during surgery with a 5/0 proline suture so it can easily be found for monitoring after surgery. This blue suture marks the area where the handheld Doppler is used to find the perforator signal and perform Doppler checks. In this video, you can hear the pulsatile sound of the flap perforator artery through the Doppler. In this video, you can hear the pulsatile sound of the artery, but if you listen in the background between the pulsatile beats of the artery, you can also hear the constant sound of a nearby vein blood flow. You may not always be able to hear the vein signal, but you should be able to find the pulsatile artery signal. Thank you for watching this presentation on the use of handheld Doppler. Please stay tuned and follow for more presentations on free flaps for OR staff.